A question I get from a lot of dental students in the third and fourth year they're about to graduate is, should I do a GPR? For those of you that don't know, GPR is a General Practice Residency. A General Practice Residency is usually a one-year residency where you get more clinical experience versus what you got in dental school. A question I get from a lot of dental students that are about to graduate is, Doc, should I do a GPR? When does a GPR make sense? A GPR is a general practice residency. It's a one-year residency for dentists that just graduated who want to get more clinical experience in general dentistry. A lot of dental students feel like they have to do it. And I think more recently over the years, they're starting to kind of wake up to the fact that it's not always worth it. And a lot of dentists are now transitioning to just going straight to practice. So when should you and when shouldn't you do a GPR? Here's my advice, not just from my own personal experience, but also what I'm seeing in the market being a clinical advisory board member in the DSO and what corporations or hiring dentists value as far as doing a GPR. So I first want to start by saying I have done a GPR and I left it 2 months early due to a number of reasons. Without getting too into the details, I was doing great in the residency. I learned a lot, but very quickly I hit a ceiling. I was seeing the most patients out of all my co-residents. I wasn't learning anymore. They had me doing a lot of homework assignments where I had to go to the hospital and get forms filled out. And there was a lot of nonsense that I felt wasn't translating to the real world of being a dentist. I knew that, you know, doing these homework assignments were not basically going to be any benefit to me in the real world of dentistry. And I don't mean like homework assignments like group projects and stuff like, I get it. It's part of a GPR. GPR is an educational extension. It's just an extension of dental school. And that's not what I'm really complaining about. It was just, there's a lot of busy work I felt like. I was spending time outside of the clinic, going to hospitals, trying to find HIV patients to do oral health screenings. And while I think after the first 2 or 3, it's good experience, but we had to do 30, 50 patients. I was spending my time learning more about the business of dentistry, and I hit a ceiling. So that's why I left. I went straight into a position where I was the managing director of a practice, where I got the real school of hard knocks. That gave me the exponential learning curve I needed to figure out what was going on in the real world of practicing dentistry and how to navigate the business of dentistry. That's my experience. Before I told you guys whether or not to do it, I just wanted to give you my background. If you had any questions, just please feel free to reach out to me. But when does a GPR make sense? I think it makes sense for these certain scenarios. The first scenario is the dental school that you went to had little to zero clinical requirements, right? So every dental school is different. I went to Rutgers School of Dental Medicine, where I think Rutgers and Temple had some of the most rigorous clinical requirements to graduate. So we had to do like 12 dentures, 19 crowns. It was one of the most clinically rigorous programs. And I felt looking back that I probably was ready to go straight to practice. But being that I was in dental school during COVID, I did have a little apprehension of, okay, am I ready? I wanted to see more of the workflow of general dentistry and focus more on endo, doing root canals on molars specifically. So I saw it as a good opportunity. I did learn how to do those things, but I think you could have learned these things by just going to practice, especially if you were in the right situation where you had people that were willing to teach you and mentor you. Another reason is if you're going to get specialized skills. Some programs do give you specialized skills such as placing implants, molar root canals. These are really high value skills that you would pay tens of thousands of dollars for in CE to learn. So if you're able to do this on top of just learning the patient flow, you're taking some of these courses that I have to offer, you're getting coaching on treatment acceptance while you're in your GPR and you're learning the business, I think you can be set up to come out and make more money than if you were to just go straight to work. But these scenarios are far and few, and with the match system that they have, you're not guaranteed to get into these programs. It's something to really think about because you can get this experience working in the field as well. And the third reason to get a GPR is because it's required, right? In New York, you need to get it done to get your dental license. Pretty much, I think that's one of the only reasons to do a GPR. If you do a GPR, you should also be learning about the business of dentistry and getting real world experience, whether you're spending your weekends shadowing a dentist in the area or starting to reach out to recruiters. You should be in your job search super early. A lot of my colleagues messed up. They were just trying to finish the residency program, and by the time they're ready to graduate, that's when they started to look for jobs. And by that time, it was slim pickings, right? Because everyone's looking at the same time. You really should start looking for jobs in your third or fourth year of dental school. You should really look as soon as possible if you know that you want to do general dentistry. For those of you that want to specialize, that's a different case. So that leads me to the fourth reason, which is you want to specialize. So if you wanted to do oral surgery, you want to do ortho, and you were unable to match your first go around, go to the GPR, stay in that academic environment, build your relationships and resume, take the test again, maybe score higher, and then go into a specialization. So that's another reason why it makes sense. So really, if you're looking to specialize, or if you're on the fence, if you're like, look, I don't know if I want to specialize or not, take the GPR and take that extra year to just think things over and build the relationships and try to do a GPR that has also those programs, right? So here are reasons not to do the GPR. Most dental students graduating think, I'm going to do a GPR because I'm automatically going to get more money. No, that doesn't make sense. Employers now don't really value the GPR over experience. It does show that you have a little bit more experience than a dental student, but if you're able to have all the character traits and you're studying in dental school treatment plan acceptance, and you can convey to employers that, hey, I understand patient psychology, I understand how to get patients to say yes, why they say no, you understand chairside manners, and you're willing to learn or invest into the CE that you need to do like molar endo or implants, depending on the practice you're in. You don't need to do a GPR, right? Because you're never going to feel ready. Even when I did a GPR and I was almost done, all of my colleagues that I graduated with, even after you do that year and you see like all these patients, you still aren't going to be ready, because in your GPR, you have the cushion of your attending who's coming in to look at your work. You still have that academic vibe where you have someone you have to answer to. And in the real world, you don't have that. It's going to be you by yourself. So the faster you can just get into the field, you'll learn the most about the business of dentistry and how to be successful in the real world of dentistry, not in this academic bubble we're so accustomed to. That's a reason why you shouldn't do it. Don't think you're just going to make more money just because you do GPR. And don't think that the GPR is going to teach you how to do dentistry in the real world. The GPR is not a real world scenario at all. You're in a bubble. You are probably getting advice from dentists who weren't able to have success in the real world, and that's why they're here teaching a GPR residency. They don't have a lot of business acumen. Otherwise, why would you be teaching at a GPR? And that's no knock to them. There's a lot of great people there who are better in an academic environment. They love to teach. No knock to them at all. But if you're someone who wants to be like, hey, I want to come out here, I want to make 400,000, I want to make $1 million, you're not going to get the valuable lessons you need in a GPR. I'm Dr. Wildman. It's good to talk to you guys. I hope this was helpful to you. I know what it's like to be in your shoes. If you're about to graduate, congratulations on all the hard work you put in. This could be a very rewarding career if you know how to navigate it. If you guys have any questions, just drop them in the comments. Hit the link in my bio. You can join my private community completely free, where I go more in depth about these things. I kind of talk on a more laid back basis and work one-on-one with you guys. If any of that interests you, just hit the link. If not, I'll see you in the next video. Thanks.